Hi, my name is Sharon Kane, and I'll be presenting a presentation regarding Ebola outbreak and the approach of this epidemic from a medical officer's point of view. This is a chronological data that has been gathered since the 2014 of the death case fatalities of the highest being 61% and is still ongoing in the Democratic Republic of the Congo. Ebola virus, what is it? Ebola hemorrhagic fever is its common name. It's rare and a fatal disease. First appeared in 1976 with two simultaneous outbreaks in Zara, South Sudan, and the other in Yambuku, Democratic Republic of the Congo. And then the new outbreak, 2014 to 2016, was the largest since the discovery in 1976, which occurred in two locations, Sierra Leone and Liberia. Currently, the outbreak is in the Eastern Democratic Republic of the Congo. So this virus, it is part of the family of the Filoviridae, it's illustrated on the left. And the most deadly and common species of this virus is called the Zaire, with the mortality rate of 70 to 90%. Transmission, it is thought to be from fruit bats from the Pteropodidae family. And then from there, Ebola was introduced to human population through close contact with the blood, secretions, organs, or other bodily fluids of infected animals such as these fruit bats or chimpanzees, gorillas, monkeys, forest antelopes, or porcupines found ill or dead or in the rainforest. And then now we have human-to-human contact that has allowed this virus to spread. So this is a great illustration of how the Ebola virus has gone from animals to humans. You have the animal-animal transmission on the left, and then the spillover to the humans as we encounter these animals. And then from humans to humans as, for example, taking care of the ill ones by touching them, by being in close contact with their bodily fluids. We are also contaminated. And then also, if caught early, there are chances of surviving this disease. Symptoms of this virus. So the Ebola virus has an incubation period of 2 to 21 days, which is the time of infection to the onset of the symptoms. And the Ebola can only spread once the patient is symptomatic. The common symptoms are fever, headaches, sore throat, body aches, vomiting, diarrhea, rash, impaired kidney function and liver function. You also have internal and external bleeding. And then also in laboratory results, you see low white blood cell count and platelets. So since the outbreak, CDC has been working hard to come up with a possible cure. And we have this vaccine called RVSV ZBOV that has gone through major trial in Guinea in 2015, where the trial involved 11,841 people, and among the 5,837 people who received the vaccine, no Ebola cases were recorded 10 days or more after the vaccinations. And so with the ongoing outbreak in Eastern Democratic Republic of the Congo, we have the RVSV ZBOV vaccine being distributed to these patients. So the role of a medical officer is to provide public awareness and also to provide the best way to protect the people in these areas, and also the healthcare providers who are there to help these patients. So community engagement is very important, just bringing awareness to the communities, making sure that they're well and knowledgeable about what's going on and how to approach situations. And then we have the vaccinations, and then if patients have early symptoms, as soon as they feel sick with symptoms of like fever, coughing, feeling more tired than usual, they should immediately receive early supportive care, such as rehydration and symptomatic treatment by these healthcare providers who are traveling to these countries. And then also, like in this illustration, this man wearing the personal protective equipment is a huge helpful barrier between those who are sick and it protects us as healthcare providers to continue to treat those who are sick. As you can see, from head to toe, his whole body is covered, and there is no gap of entry for this virus to enter. So for a good outbreak control requires case management, surveillance, contact tracing, good laboratory services, safe burial, and social mobilization. As you can see, there's a man holding a poster showing the community, especially children who can be easily infected by the virus, to know what signs to look out for and what to do to prevent being infected. And so also in the film demonstrates nurses who are walking around their neighborhood spreading words about the risk and the symptoms to watch out for, and also protective measures to take. 4 factors that can help reduce this outbreak is reducing wildlife to human contact, reducing the risk of human-to-human transmission, therefore heavily enforcing regular hand washing wherever they go, whatever they do before and after. Outbreak containment measurements are very important, and then reducing the risk of possible sexual transmission. So WHO has recommendations for male survivors of this virus to practice safe sex and hygiene for 12 months from the onset of the symptom, or until their semen tests negative twice for the Ebola virus. Other recommendations that we would suggest are providing programs for those who survived this virus, and then also for the family of the survivors on how to go about their daily lives after this incident. And then also programs for psychological and supportive programs for families who has lost their loved ones to this virus. Providing resources, providing healthier food that is not tainted by this virus. Also diagnostic tests like the automated or semi-automated nucleic acid test for routine diagnostic management. And then we also have the rapid antigen detection test for those who volunteer to help out to bring or to spread the word to more isolated communities far away from the main city, and to to bring the awareness to these people and make sure that these people are not infected. And then these places where they go, these nucleic acid tests are not available, so the rapid antigen detection would be more accessible. Thank you for watching this video. I hope this was educational and helpful.